What if I told you that the key to stronger and longer-lasting erections isn't in the pharmacy, but in your own hands? You might think that's impossible, that virility fades with the years, and that the only solution is a blue pill. But what if I told you that I've seen countless men in their 50s, 60s, and even 70s restore their confidence and vitality with something as simple as a 2-minute massage per day? I've seen how this small ritual has changed not just their sex life, but also their self-esteem, their energy, and their sense of control. I'm Dr. Theodore Chambers, a urologist with over 15 years of experience, helping men navigate the challenges of male health in a way that conventional medicine often ignores. And today I'm here to share with you one of the best-kept secrets of urology, something that most doctors simply don't have the time or knowledge to explain. It's not a miracle supplement, it's not a magic pill, and it doesn't require a prescription. It's a 2-minute protocol, a simple massage you can do at home that can transform the quality of your erections by improving blood flow and nerve function in the most important zone. But here's the twist. Most men focus on the wrong places. The real power isn't in massaging the penis, but in a zone that most men don't even know exists, the perineum. And the biggest secret of all is a specific technique for that area that most men have never considered. Before we continue, I'd love to hear from you. Leave me a comment telling me what country you're watching from. Your participation grows this community of brave men who have decided to take control of their sexual health. Your voice matters. So stay with me, because in the next few minutes I'll guide you through this protocol. I'll show you exactly how to do it. I'll explain the science behind why it works. And I'll tell you the story of one of my patients who went from desperation to confidence in just a few weeks. And if you find this useful, please give this video a like and subscribe for more tips that really work without expensive pills or invasive treatments. Let's start with the first step of this 2-minute protocol, a step that feels simple but has a profound impact. It's about massaging the perineum. Perhaps you've never heard that word. The perineum is that small area of skin between the scrotum and the anus. It's an area that rarely receives attention, but it's a vital highway for male sexual health. Not long ago I met a man, let's call him Robert, a retired engineer, 64 years old, from Chicago. He came to my practice with the same problem so many men have: weak, often incomplete erections. He was frustrated, embarrassed, and felt his sex life was coming to an end. He'd tried pills, but they made him nervous and gave him headaches, and the results were inconsistent. I asked him if he'd worried about blood flow in that area, and he looked at me confused. "I've tried everything," he said, "but blood flow, I don't." That's where I introduced him to the power of perineal massage. You see, the perineum isn't just a forgotten body part. It's home to the pelvic floor muscles, and most importantly, the cavernous arteries that carry blood to your corpora cavernosa, the spongy tissues inside your penis that fill with blood to create an erection. As we age, sedentary lifestyle, poor posture, and muscle tension can compromise blood flow in this area. Think of it like a garden hose being stepped on. No matter how powerful the pump is, if there's a blockage or pressure on the hose, the water won't flow freely. Your perineum is that hose, and tight or weak muscles can restrict that flow. Perineal massage, when done correctly, acts as a liberator. It helps relax the pelvic floor muscles, reduces tension, and most importantly, promotes vasodilation, the opening of blood vessels. This allows blood to flow with less resistance toward the penis. How to do it? It's simple. Sit comfortably or lie on your back. Use the tips of your index and middle fingers. Press gently in the center of the perineum, in the area between the scrotum and anus. Move your fingers in small circles, applying gentle but firm pressure. You don't need a special oil, although coconut oil or a neutral massage oil can help. Do this for 1 minute, moving slowly and breathing deeply. The sensation should be release, not pain. After a week, Robert returned to my office with a smile I hadn't seen before. "Doctor," he said, Not only is my erection stronger, but I also have more control. I feel a connection and strength I haven't felt in years. And that's the power of this first step, reconnecting with a part of your body that's been working silently all these years and giving it the attention it deserves. Now, if you think 1 minute of perineal massage is powerful, wait until you see what happens when you combine that step with the next. The second step is scrotal massage, the testosterone engine. After helping Robert with the perineal massage, his next question was, is there anything else? He knew he'd found the thread of a deeper solution, not just a quick patch. And that's where I explained the importance of scrotal massage, a habit that's both healing and preventive. Throughout my career, I've seen countless men struggle with weak erections and at the same time with low energy levels, loss of muscle mass, and a feeling of chronic fatigue. These symptoms are often interconnected, and invisibly the problem may be literally hidden in your pants. The scrotum, that skin sac that holds the testicles, isn't just a container, it's a thermoregulation system. The testicles need to be at a lower temperature than the rest of the body to produce quality sperm, and what's crucial, to produce testosterone efficiently. Sedentary lifestyle, tight clothing, being overweight, all these factors can cause the temperature in the scrotum to rise, which in turn can compromise testosterone production. Scrotal massage, when performed regularly, does two incredibly important things. First, it improves blood circulation in the zone, which helps dissipate heat and maintain an optimal temperature. This is like giving your testicles the perfect environment to do their job. Second, and this is something few know, it helps reduce muscle tension in the area. Think of it like a neck massage, but for a much more vital zone. Tension accumulated in the scrotum and surrounding area can be a factor contributing to discomfort and poor circulation. To perform the massage, sit or lie down. Use your hands gently to hold the testicles. Don't squeeze them, just hold them. Use your thumbs to gently massage the skin of the scrotum, moving in small circles. Don't apply direct pressure on the testicles themselves. Just massage the skin and surrounding tissues. Then, with the index finger and thumb of one hand, gently massage the spermatic cord, the duct that extends from the top of the testicle toward the abdomen. Follow this duct with your fingers, massaging gently. This helps release tension and improve circulation along this vital pathway. Do this for 1 minute, focusing on gentleness and deep breathing. Robert, after a week of combining both massages, returned with a new light in his eyes. "Doctor," he said, "it's not just about my erection anymore. I feel more energetic. My mood has improved. It's like a part of me that was asleep has awakened." And that's exactly what happens. You're activating a system, not just solving a symptom. Scrotal massage doesn't just help improve blood flow, but by creating a more optimal environment for the testicles, it can help support natural testosterone production. A study from Boston University found that improved blood flow in the testicles is directly related to better testicular function. And most importantly, this gives you back control. You're not dependent on a pill, you're not waiting for a miracle. You're activating your own body's natural healing. What I like most about this habit is that it's about self-care. It's a moment for you, a moment to reconnect and to honor your body. And by doing so, you're laying the foundation for a fuller life, not just for better erections, but for an overall sense of well-being. But as powerful as these two massages are, there's a third step, something most men do incorrectly and that can sabotage all their efforts. A simple breathing trick that can amplify the power of these massages and take your erections to the next level. The third and final step of this protocol is something that seems so simple you might overlook it. But it's the piece that ties everything together. The one that takes the improved circulation from the massages and turns it into a strong and reliable erection. After Robert felt better with the massages, he noticed something else. Sometimes the erection was strong, but the anxiety about whether it would last or not made it weaken. His mind was his worst enemy. That's where I introduced him to the concept of deep breathing and anchoring. You see, erection is a vascular phenomenon. That's true, but it's also controlled by the nervous system. Specifically, the parasympathetic nervous system, the rest and digest system, is the one that allows blood flow to flood the perineal. The sympathetic system, the fight or flight one, is its directive viscery. When we're anxious, stressed or worried, our sympathetic system activates, restricting blood flow and making it almost impossible to maintain an erection. And most men in the moment of intimacy are in a state of silent stress. Will it work? Will I be good enough? This anxiety, this internal dialogue, is a silent killer of erection. The solution is simple, but requires practice. While performing the perineal and scrotal massages, I teach my patients to combine it with deep and conscious breathing. Breathe in through your nose for 4 seconds. Feel how your abdomen expands. Breathe out through your mouth for 6 seconds. Repeat this 10 times while performing the massage. This deep breathing signals your nervous system to relax. It changes your body's state from stress to rest, from sympathetic to parasympathetic. It's like telling your body, everything is okay, you can relax and do your job. Anchoring is the next step. As you breathe and massage, focus on the sensations, the warmth of your hands, the pressure, the release of tension. Don't think about the outcome. Don't focus on whether it will work or not. Simply focus on the moment, on the sensation. This anchoring brings you back to the present and prevents your mind from getting lost in anxiety. When Robert started combining the massages with this breathing, not only did his erection improve, but his confidence skyrocketed. "Doctor," he told me, "the anxiety is simply gone. I'm not in my head anymore, I'm in my body." And that's the victory. The physical improvement is important, but the psychological change is what makes strong and reliable erections sustainable. This final step is the crown jewel of the protocol. It not only maximizes the effects of the massages, but teaches you how to manage your body's response to stress and anxiety, a skill that will serve you for the rest of your life. If you've made it this far, I want to thank you for listening with an open mind. As someone who has worked with men for over 15 years, I can tell you that the biggest obstacle to male sexual health isn't age, but the lack of knowledge and the silent shame that prevents men from seeking real solutions. But you're here, and that means you're ready to take control. So let's bring it all together. 3 steps, 2 minutes that can change the course of your sex life. First, perineal massage. You learned that this area is a vital highway for blood flow and that massaging it gently can release tension and improve circulation. This small act is the first step to unlocking the virility you thought was gone forever. Second, scrotal massage. You discovered that maintaining an optimal temperature and good circulation in the scrotum is fundamental for testosterone production and overall well-being. It's a self-care massage that feeds the engine of your masculinity. And finally, the third step, deep breathing and anchoring. I showed you how to control your nervous system, how to shift from stress to rest, and how this simple technique can amplify the effects of the massages, making your erections not just stronger, but also more reliable and sustainable. What I want you to remember is that this protocol isn't about perfection, it's about consistency. 2 minutes per day, every day, is a commitment that can yield great dividends. I've seen men who were skeptical at first come back and tell me not just about the improvement in their erections, but also about a renewed sense of confidence, energy and joy. It's the kind of change that spreads through your whole life. Give me a like, please, if this message has helped you. Share this video with other men you know are struggling in silence. Subscribe to the channel if you haven't yet, so this community of brave men keeps growing. And leave me your country in the comments. Your experience can help another man who's suffering without a voice. Here there's no shame, only real solutions. You deserve to feel strong again. You deserve to live without shame or doubt. And the best time to start caring for your vitality is right now. I'm Dr. Theodore Chambers, and your sexual health begins with these 2 minutes per day. See you soon.